All right. Well, hello and welcome everybody to our Journeys in HBHE series. This is our new effort to try to highlight the career journeys of some of our HBHE faculty. So I'm Scott Roberts. I'm interim chair of HBHE, and I'm really excited to have Barbara Israel with me today. So many of you know Barbara. She's a professor in the department and directs the Detroit Urban Research Center and has been a pioneering figure in the world of community-based participatory research. And so we're really excited to have you, Barbara. Thanks for joining me.
Thank you for inviting me. Appreciate it, Scott.
Yeah. So I thought we could just start at the beginning of your public health journey. So I know you trained at an institution called the University of North Carolina at Chapel Hill. And for those viewers out there who may not know, Barbara and I have a long history of Duke UNC trash talk, but I have a lot of respect for UNC's public health programs. And of course, they've trained many of our faculty over the years. And Barbara, you'll be excited to see I've got a kind of Carolina blue
And there you
pinstripe
go.
shirt on in your honor.
There you go. And look, this is sort of Carolina blue. I hadn't even thought about that.
But yeah, so tell us more though about how you decided to even get into graduate work at UNC and get into the field of public health. I know you did your MPH and DRPH degrees there, but
Right.
was public health something you were thinking about from a very young age, or how did you get turned on to the field to where
Yeah.
you decided to pursue that training?
Yeah, thank you, Scott. Great question. So actually, I don't think I'd ever even heard of public health till I was in my 20s. There were no such thing as undergraduate programs in public health, at least that I'd ever heard of. So I'll go way far back, if you will, to get us started. But growing up, I grew up in the South in North Carolina of a Jewish family. And one of the things my parents really instilled in us was a commitment to social justice and racial justice. My undergraduate education was focused on sociology and city and regional planning. And after I graduated, I worked as a community organizer for 3 years in North Carolina in Guilford County at a community mental health center. And during that time, I had the good fortune to attend, just sort of not randomly, but was invited and attended a lunch meeting for health educators, which again, I didn't know what a health educator was because I was a community organizer. And one of the speakers was Guy Stewart, who at the time was the chair of the Department of Health Education at UNC Chapel Hill School of Public Health. And he spoke so passionately, so compellingly about what we now call social determinants of health, but that was not labeled at that point in time, and the importance of community involvement and power and control over decisions that impact their lives. And again, at the time I was doing community organizing, and it really touched me in a way that I hadn't expected. And I sort of said to myself, if I were to ever go back to graduate school, I want to study with Guy Stewart. And 2 years later, I applied only to UNC Chapel Hill School of Public Health. So had I not gotten in, and who knows what I'd be doing now. But I did, originally just to get a master's degree. He was my academic advisor. And then it became clear to me that I needed additional skills. At the time, I really wanted to better be able to assess and evaluate community level interventions, and that the doctorate would enable me to do that. And Guy continued to be my academic advisor as a doctoral student. And at that time, I had not decided that my endpoint would be academia. It was really still more, how do I do practice, but public health practice in community settings to bring about social change. But that's how I got into public health.
Yeah, well, that's great to hear. And it sounds like, you had a mentor in mind from the beginning of applying to graduate school, but is it correct to say that you were contemplating just getting a terminal master's and then going back out into practice, but then one thing led to another while you were in?
Absolutely.
Okay.
Absolutely. And, I won't go into it here, but, I had a lot of other mentors in the program as well. But in terms of sort of how I got into public health, it was definitely Guy Stewart that
Nice.
introduced me to to public health.
So what did your dissertation focus on?
So well, that's it. Do you want to include that into the question about following? How did I end up at Michigan? Or are you going to ask that separately?
Yeah, I was gonna, well, unless it kind of naturally flows, but I was just kind of curious what you ended up
Okay, all
focusing
right.
on for your dissertation work, and then we'll
So my
jump into that.
dissertation was focused on social support and social networks, and stress as it related to health outcomes, particularly mental health, among older women. I actually did a secondary data analysis. I have a DRPH, a doctorate in public health, not a PhD. And at the time in the program at Chapel Hill, your dissertation was not supposed to be a basic research dissertation. It was supposed to be more of an intervention research. But I decided, if I were ever going to do anything quantitative, this would be a good time to do it and to learn the skills. And the program was much more loosely organized, I would say, at that time than it is now. And so Guy was good with that. So I actually, based on the dissertation I did, I technically speaking should have gotten a PhD, but I wanted the DRPH because for me, the practice component has always been so important. And to differentiate that yes, I'm about research, but it's research for change and research for practice.
Mhm.
So that was my dissertation.
Yeah, yeah. And so then you complete your PH at UNC, you're thinking about next steps, and then is that when the University of Michigan position emerged at the end of your doctoral training? So yeah, tell us a little bit more about it, or how you got to us here in Ann Arbor.
Right, right. So again, it's a very long story, but I'll try to make it as short as possible. Again, as I'd mentioned before, I had not necessarily was on a career path for an academic position. That was not where I started in terms of getting the doctorate. But in the spring of 1981, I was just beginning to work on my dissertation. I had just had my prospectus approved. But I hadn't done the data analysis. I hadn't written chapters yet or anything. But one of my faculty colleagues at UNC, Godfrey Hochbaum, had been contacted by a faculty member here at Michigan, Scott Simons, who was chair of the search committee at the time. And Scott said, do you have anybody who's graduating who could apply for our position? And the position was specifically for someone that had a community-based orientation and training. The department had gone through an evaluation, an external review, and one of the recommendations was that they needed to hire 2 faculty positions, specifically doing community level interventions and work, given that at the time in the department was primarily faculty doing work at the individual behavior level. And this search had been open for almost 2 years. They hired one person the first year, and they were coming to the close of the second year and still hadn't hired someone. So I think they were desperate. No, so long story short, again, Scott encouraged me to apply. And I said, no, I haven't written my dissertation. I'm not on the job market. It's not, Michigan's a great place, but I'm not sure I want to go into academia and so forth. And then thought they would leave me alone. But about 2 months later, Scott comes back to Godfrey, who comes back to me and says, you've got to apply, etc. And so I sort of, the other thing that was a drawback, this was again the early 80s. I hadn't updated my CV in 5 years. I didn't have a laptop computer, this was not something you kept, I didn't need to update my, CV, etc. as a graduate student. So it wasn't just a matter of sending in your CV and be done with it. So long story short, still, I updated my CV, I got it submitted, I was invited for a job talk. I couldn't talk about my dissertation results because I didn't have any yet. So that was pretty unusual. Instead, I talked about some work that I was doing, some training capacity building work I was doing around community assessment. And I got offered the position. And, I wasn't sure I wanted the position, even though, again, people were saying, what do you mean? How could you turn the University of Michigan down? It's an incredible place. And I said, I understand that, but, I'm not on the job market. I have nothing to compare it to. I haven't written my dissertation. And the other thing, at the time, there was only one other woman faculty in the department. And that was Dr. Noreen Clark, who had been hired the year before as part of this 2-year search process. And she had been out of the country when I came for my job talk, so I'd not had a chance to meet her. So I said I wanted to come back and have a chance to meet her and get a better sense of, the department and so forth. And I was able to do that. And Noreen and I immediately connected. She became a very close friend and colleague. And I felt like, okay, I would be supported by her. Not that I wouldn't by the 12 male faculty, but it was a very different
Yeah.
environment to think of coming into. And ultimately I accepted the position. And again, another thing, I was the only assistant professor. Everyone else was full professors. So it was quite a unique environment to come into. And it was accepted it upon finishing my dissertation in December. This was May now, and so I had like 6 months to do my data analysis and write my dissertation. And I defended in December of 81, and 2 weeks later, I started the position at Michigan
Wow.
in January of 82. Which is nothing I ever recommend to current doctoral students. Now people always have postdocs, and to me, that what a luxury, to have had 2 years. I mean, I had 2 weeks, so it was an interesting transition, but
Wow.
very
Yeah,
fortunate.
that's fascinating. Well, I'm just thinking how fortunate our school was. I mean, what a time to have Noreen and you both like join within a relatively short period of time and both go on to these such legendary, distinguished careers. For our viewers who may not know much about Noreen, she ended up, being a wonderful dean for our school, and I know a great mentor to you, Barbara. So
Yeah,
quite
absolutely.
a quite a 1-2 hiring coup for our school.
I was very fortunate. And one other thing I might add is that, because I hadn't necessarily, committed that academia was the way I wanted to go, I naively at the time thought, well, I'll come and try it out for a year or two. And if I don't like it, I can leave.
Mhm.
And within, 6 weeks of being here, it's really clear if you're going to survive, you've got to commit and just
Yeah.
do everything you can to get tenure and to be promoted and so forth and so on. So I was up and running, and never looked back, and I haven't, and have been good with that.
Yeah. Well, here over 40 years later, you're still sticking with it, right?
Yeah, yeah, hard to believe.
Well, yeah, so I wanted to ask next a little bit. So you're known a lot for your work in community-based participatory research. And so I wanted to hear more about how you did some of this formative work and kind of put it on the map in a lot of ways. I know I'm sure with a lot of other colleagues as well, but just talk about some of the challenges and successes you had as you and this field evolved over time.
Right, thank you. So a little bit in terms of, um, again, just trying to figure out how to shortcut, but I will get to the challenges. I mean, when I first came to Michigan, I didn't have a set of colleagues doing community work, as I just explained, and I actually did some what's referred to as participatory action research in a workplace in an automobile plant for the first 5-7 years that I was here. But I always wanted to get into communities and did some consulting and other work on the side. But then fortunately, through funding from the Kellogg Foundation, we received funding for what was called the Community-Based Public Health Initiative. And again, this was before the term CBPR was up and running. The concept of participatory research and participatory action research, which really comes from developing countries, had been around for a long time, as had action research. But the CBPR label came about, in the context of my career and others that I worked with. So that initial Kellogg funding really helped us within the school, because Kellogg, and this has always fascinated me about foundations, that they try to set an agenda. They do set an agenda through their funding, which, can have a major impact. And they were interested in trying to change the way schools of public health and local health departments did business to be more community engaged, community driven, community centered. And so you had to create a partnership between community health departments and schools of public health, very specifically schools of public health. So, fast forward from there, we were able to get funding for the Detroit Urban Research Center in 1995, which was focused in Detroit. And at that point, we did have a set of, we were still calling it community-based research. It later, the label community-based participatory research, primarily to differentiate. We began to understand that a lot of people talked about doing community-based research, which was physically placed in communities, but did not have an emphasis on community engagement, community power sharing, co-learning, etc., that CBPR does. And so inserting the participatory term helped differentiate that from, again, community placed research, if you will, which was, a lot of people were doing, meaning outside of the laboratory. That was not, our approach to the research. So, this again in 1995, some of the challenges, there was a lack of understanding of what CBPR was, perception on the part, and then particularly in terms of within academia, that it was biased and less rigorous, because if you let community members have influence over the research questions or how you designed your survey, that somehow that tainted the rigor of, if you will, and the quality of the research, and general sort of lack of respect, if you will, on the part of colleagues. And tied in with all this, junior faculty were often told, you can't do CBPR as a junior faculty. You won't ever get tenure. Wait till you get tenure and then start using a CBPR approach. So there was a whole, cadre of challenges, if you will, within the academic scene. And others challenges, there was very limited federal funding for CBPR at that point. The emphasis within public health was very much on individual behavior change, not on community level change or social change. And randomized clinical trials were and still are considered the gold standard for research, which is antithetical in a lot of ways to CBPR, which has an emphasis on transparency and equity. This notion within communities that there's going to be a group that, quote, gets nothing, just doesn't sit well in, at least certainly not in the communities I work with. I'll say some more later about how we were able to get beyond that, but that was a real challenge. And community entities were understandably very distrustful of the university coming, into the community, and distrustful of research, given the harms that research has done in the past in many communities, particularly communities of color. And so that reluctance, with the Detroit Urban Research Center, it took a year and a half after we'd gotten funding, but a year and a half before it became clear that the community partners trusted us and were willing to move forward. And it was, they were like, "You're from the University of Michigan. What have you done for us lately?" One of our partners referred to it as drive-by research, that the researcher comes in, gets the data and drives out. And that's what they were used to. And so, again, very understandably, why should they trust me? I'm another outsider, as it were. So that was another challenge. And part of that challenge was sort of acknowledging and addressing the fact that, as a white, middle-class, highly educated woman coming in from who knows where, into the city of Detroit, how can I establish relationships, establish trust to be able to do this work together in partnership with communities? So that was a real challenge, again, understandably. But those are some of the things, and it was not easy, those early days, and fortunately we got funding from CDC, mean, one of the things, from the university standpoint, and, since I was able to get external funding, that was a real positive thing, obviously. And so I was sort of left to my own devices to do the work that I wanted to do, and I was publishing. But in the context of doing that work and doing those publications, there were all these sort of challenges to get this up and running and have it be valued and respected and accomplish the work we wanted to set out to do.
Yeah, so what would you attribute your success to then in terms of turning the tide and addressing these kinds of challenges? Either you're talking about in the context of gaining the trust of your Detroit partners, or more broadly for the field of CBPR, to kind of gain more acceptance in the broader academic world?
Sure. So I think, in terms of in Detroit, it was, and one of the things our partners say to us, I mean, the fact that we wouldn't leave. I mean, they used to jokingly with, after, we became, a strong partnership, they say, we used to throw things at you to see if you would do it or not, and the fact that you would do them and still didn't leave, after a while, we sort of felt like, oh, these folks are real, they're authentic, they're serious, they're not just here today, gone tomorrow. And so we really had to prove that we were trustworthy. And that took a lot of time, like I said, 1.5 years of meetings, of sharing, of listening, doing a lot of listening, and not imposing, our agenda, if you will, but rather trying to figure out what a collective agenda would be amongst this group of partners. And I think that, we did, we used a lot of we developed CBPR principles, we developed operating norms, a lot of process kinds of issues, which at the time, for the first year, the other thing we did, we evaluated the partnership process. And our partners have again later said that to them sent a message that, we were serious about changing how we work together if things didn't come out well in the evaluation. The fact that we were willing to look at that and ask those questions of them and honestly do something with the results. And so that partnership evaluation became really critical. And one of the things we learned after the first year, people were just so fed up of process. When are we going to get to doing an intervention? When are we going to get to change, et cetera, et cetera? But then, we did on some level of evaluation every year, but at about 5 years, when we did in-depth interviews, all of the partners in academic and community said, had we not spent that time on process and developing the relationships, that we wouldn't still be together. So it's this sort of trade-off between task and process, but establishing the trust and then getting the work done.
Right.
So in terms of some of our successes, which you were alluded to, I mean, I think one of the big things is we've been able, through our affiliated partnerships of the Detroit URC, to conduct interventions that have had positive outcomes and have actually become part of the evidence base for successful change strategies, specifically related to heart health, related to childhood asthma. And so these are interventions that, like I said, have been published in the peer review process. And, one of them is in NCI's recognized evidence-based interventions. And then we did both of those using what we referred to as a staggered and delayed research design, so that rather than a randomized controlled trial. So ultimately, everybody got the intervention, but it was either staggered over 1 year or delayed by 8 weeks. And so that's, again, a way methodologically we could get the results that were needed to show the evidence base, but not using a randomized controlled trial where a group didn't get anything, if you will. So in keeping with our CBPR principles. We've had several of our partnerships have effectively used data from our research to influence policy change. Most recently, this has been related to mitigation strategies to reduce exposure to air pollution, which is a big issue in the city of Detroit, which in turn is associated with childhood asthma and heart disease. And so that, using data to inform policy has been a real success and continues to be a priority of a number of our partnerships. The other thing, I think we've been able to build bridges across disciplines and have created transdisciplinary teams, if you will, which, given the complexity of the issues that members of the community face and the communities face, we really need to bring in people from disciplines. So, for example, our community action against asthma, where we've looked at air quality and childhood asthma, we brought in engineers, we brought in air quality experts, we brought in pediatric pulmonologists. I don't have any of those skills, right? But I have the skills of being able to bring the partnerships together, to work together for designing the intervention and bringing about change. So that transdisciplinary approach, I think, has been really effective. We've also provided funding support and capacity building to activities that have greatly increased the number of partnerships, CBPR partnerships on the campus at University of Michigan, so outside of the School of Public Health, as well as across the country through some national NIH funding. And those partnerships in turn have had an impact on the communities they work with and on addressing health equities, and not just health issues, but very broadly defined social determinants of health, issues around housing and transportation and so forth. So I think that's been a real success. The other is, we early on spent time meeting with folks at NIH, different institutes, to try to encourage them to increase funding for CBPR and partnership approaches to research. And I think, have been quite successful in that. It's still not nearly as much funding as we'd like, but it's a lot more than it was. And then another thing I think that's a success, but also still a work in progress, is increased appreciation within the school and within the university of the value of a CBPR approach. But again, that's, I long ago realized everybody's not going to value it, and it's not for everybody to use. It's not an approach to research that everybody's suited for. What I always aspire to is mutual respect, and go from there, if you will. And I definitely feel like that has increased considerably. Yeah. So those are just a few of the successes I think we've been able to accomplish.
Yeah, and then looking forward for the field, maybe like the next 10 years or even more, like what do you see as some of the big challenges and opportunities in the next steps, whether for the field writ large or for your Detroit center?
Sure. So I think one of the challenges, I think, is there's been a lot more attention played, funding committed to what's being called community engagement and community engaged research. And often that looks a lot like community-based participatory research, but there's also a lot where it's more involving communities in an advisory capacity, but where the researcher still decides on the research question, still comes up with the protocol, still decides how to disseminate, whether there's any funding that's provided directly to the community, et cetera. So, really doesn't adhere to the kind of principles of equity that CBPR aspires to. And there's a lot of NIH funding that now requires community engagement, which is great, but it's some people sometimes say to me it's CBPR light, which I don't like that analogy. But I think that's something that's a challenge going forward, is how do you really, strive for community-driven research, and, we think about it as a continuum, and as compared to investigator-driven, there's a lot in between. And so that's a challenge, I think, continually. Another is, while I think there's been movement and successes, still the tenure and promotion process still favors certain types of outputs and indicators that are not always consistent with the CBPR approach. There's some universities, schools of public health, which I will not name, but which have, now recognized, and you can have an external letter written by a community partner. I mean, that's, I don't think, going to be embraced widely across the country, but those are the kinds of things that are still a challenge, for junior faculty, if they feel like they're in a place that they're not likely to get tenure if they use a CBPR approach. So that's another challenge, if you will. So those are just a couple.
Yeah. Well, no, I think even in just my time here, I feel like I've seen some of the changes in attitudes and acceptance that you're talking about. And yeah, this issue of also, I also resonate with your thoughts about being wary about not conflating CBPR with just any kind of community engaged approach. And so thinking kind of a continuum. And yeah, maybe certain strategies make sense depending on the context, but to be recognize some of the important differences too along that continuum seem important.
Yeah, no, I appreciate that. Thanks.
Well, I wanted to shift gears a little bit here. So you're going to be retiring before too long. So I imagine you might be in a little bit of a reflective mode. And thank you for sharing the article you sent earlier. Or maybe if this gets posted to our website, we could also partner this video with that piece, because I think it kind of is very much you reflecting on your career journey. But I just wanted to hear more about what you've appreciated the most about being a U of M SPH faculty member over the years and getting to lead the Detroit URC for many years now. What are some of your greatest joys you've had in these roles?
So I know sometimes it sounds trite, but it really, for me, by far has been the people I work with. Again, the content area of a lot of the projects and partnerships we've worked on are not areas that I don't have a content expertise. I don't have a disease or body part that I'm particularly knowledgeable about. But I have learned so much in the context of working with diverse colleagues, both academic and community and staff, who become my friends, and being part of a support network, if you will, of colleagues that have social justice values has just been, career inspiring for me. In particular, I'm inspired by my Detroit partners, their passion, their long-term commitments, their knowledge, skills, and understanding of change processes, and their continued hope and resilience in the face of, really incredible ongoing racism, environmental injustices, and other challenges that they face in Detroit. And that, I come back to Ann Arbor and we don't face a lot of those issues. And it's 45 minutes away. And so just being surrounded by that kind of network of colleagues that have that focus and commitment has just been a real pleasure. And it's what keeps me going. And it's what gives me hope, because, if they can maintain that hope and resilience in light of what they face, who am I to get, burned out or worried, not that things aren't bad, but again, it just gives me the hope to continue to do the work that I do.
On that note, sorry to interrupt for a second. I just wanted to, is there any one kind of example or story that would kind of illustrate what you're talking about and the ways in which your community partners have inspired you?
Well, again, right now, the whole issue of air pollution in Southwest Detroit, we've been doing the research. One of our first studies, community action against asthma, started 20 years ago, sorry. And so we've been able to show the amount of air pollution, the disproportionate amount in Southwest Detroit, the impact that it's had on on asthma, hypertension, heart disease, and there's, I can't begin to describe the facilities there in terms of the number of air polluting plants and steel mill is manufacturing, if you will, um, and the impact that's had on people's health and their family and their kids. Childhood asthma is a real issue. One of our partners talks about, if you go into any classroom in an elementary school, there'll be 10 inhalers on the teacher's desk because 10 kids in the classroom have asthma, and they're having to help, have those inhalers if they need them during the day. And for me, to face that day in and day out for years and years and years, and then here comes, just a couple of weeks ago, a request from a cement company to put in a cement crushing factory in Southwest Detroit. How do you just keep at it, But they do, and they've just had last 2 weeks ago, a press conference. We were bringing community members together, and trying to speak to Eagle, which is the statewide agency that can give permitting agency. And so they're trying to get a permit to do this. Why they don't need any more, pollution sources in their community, if you will. And they live, breathe, eat, sleep, this work, because it's their community, it's their families, it's their children, their grandchildren, and so forth. And they're just incredibly adept at different strategies and very committed and keep at it. And to me, that's just so inspiring, because I can easily get overwhelmed, in face of those kinds of conditions. And not that they don't too, but they don't let it get to them in a way that they stop doing what they're doing. And what's been great in terms of the research and what they've said, and we've said together, is that having the data that we've been able to together through these CBPR partnerships to collect is really compelling evidence that has had an impact on policy change in the city. A major policy, over $40 million with the Gordie Howe Bridge of community benefits that the community received. And again, they're convinced that it was a lot of the reason was that they could take the data that's so compelling that, again, they were part of collecting to bring about those policy wins, if you will. So that's all of that's a piece and parcel of it, if you will.
Yeah, thanks. That really does speak to this theme of resilience that you're talking about. But sorry, I interrupted you. You might have been ready to talk about other things that brought you joy along the way, and you're
no, thank you for reminding me of the question. Yeah, I mean, the other is the students. I mean, I'm continuously energized by our students. I mean, their passion, their commitment to addressing inequities. It's just, that's so much of why I do what I do. And, it brings me great joy to see what they go on and do, former students, and the kinds of things they're able to accomplish. And often, I just recently ran into a student from 30 years ago, and she was talking about one of my courses and how she still uses what she learned in the course and the work she does. And it's like, wow, that's a lot of why I do what I do. The teaching is just so important to me, and the students I work with, and being able in some small way to mentor them and learn from them as well. So that's a real big one for me.
Yeah, for those who are viewing this, Barbara and I were just attended earlier this afternoon in a HBHE alumni panel where 3 outstanding alums of ours were talking about their career journeys. And I know you worked with some of them, and so I imagine they're kind of part of this example of former students who you kind of see they spread their wings and they're able to do great things and apply what they learned in courses and research with you. So,
yeah, that's great.
Well, I guess my final question here probably draws upon some of what we've already talked about in different ways, but I just, as you kind of, again, are in this maybe reflective mode, thinking back on your career, what are some of the things you're proudest of in terms of your body of work and your achievements?
Okay, great, thanks. So for sure, one that we just talked about was, with the role of students and working with students and what they've gone on to accomplish and will continue to go on and accomplish. I recently spent a weekend with a former doctoral student who's actually retired. And so this is one of my doctoral
They
students.
beat you to it, huh?
And she's already retired. She also, I will never forget when she got she became on the faculty, actually at School of Social Work. When she got tenure, and then when she got promoted to a full professor, I was saying, wow, this is, a former student of mine is now a full professor. I've been doing this a while. But the other thing in terms of, sort of, it's important for me to acknowledge that most of what I've achieved has not been by myself alone. By definition, CBPR is a collaborative approach. It's a collective approach. It's working with other people in trying to address health inequities. And so, all these things I'm proud of, I frame in those terms. So first and foremost is being part of CBPR teams and partnerships, where we've been able to secure external funding, we've been able to conduct successful interventions and policy changes that have had an impact on health inequities in the city of Detroit. That's just incredibly rewarding for me to have been a part of those and to continue to be so. The other is, helping to create a network of colleagues within the school and across the university that embrace and actively engage in CBPR. So there's a number of, committees I've sat on that, have brought others together, initiatives that we've created that have increased the number of faculty doing this work and the value that's being placed on it, et cetera. It extends beyond the school public health. It's certainly the school is part of that, but extends beyond that. And another, just being a part of a network of community and academic colleagues that have had an impact on the field in a couple of ways. One of which is increasing the capacity of community academic teams to conduct CBPR around the country. So we've, in addition to the work in Detroit, we've done a lot of capacity building work and bringing together teams, for a year-long program to learn about CBPR, and they in turn are going off and doing incredible work. So that's been very rewarding. And in other areas, increasing opportunities and the role of communities and community partners in the American Public Health Association. There's now a community-based public health caucus. There's a national community organization that's part of the APHA. There's community members that attend APHA. I mean, 30, 40 years ago, if you didn't have at least an undergraduate degree, but mostly master's and PhD degrees, attending APHA, the annual meeting of the American Public Health Association. And very excitingly, the new incoming president-elect of APHA is one of the people I worked with in Flint back during the Kellogg-funded CBPH days. And this is a first for a community person to be elected as president of APHA. So that just feels very exciting and rewarding. And then a third area is increasing the support for and recognition of CBPR as a viable approach to conducting research and promoting health equity. And again, both locally, but also nationally and around the world, and being part of teams of other people. I have groups of colleagues all over the world that are doing this work that just feels like it's, been a really positive experience. I feel like I've been incredibly fortunate to work with people in Detroit, within the school, the university, throughout the country, and really am humbled, by the opportunity you've provided for me to share some of these experiences, and really appreciate that.
Of course, yeah, it's been quite a legacy you're leaving, Barbara. And I think, I came here 17 years ago, and I just appreciate the support you provided as kind of a more experienced colleague. Even though we didn't formally collaborate, I think in a lot of ways you've been someone I could turn to for advice or guidance. So I know if that's that way for me as just not a formal colleague, I can imagine those who've gotten to work with you for so long and so extensively, whether they be students, staff, faculty, alums, etc. So we're really really proud of all you've been able to accomplish, and I hope this final official academic year for you is rewarding, and this is just one way for us to kind of reflect together on what you and your teams have been able to do. So thanks so much for joining us for this kickoff to our Journeys in HBHE series. And
Thank you again.
yeah, well, thanks, Barbara. We'll wrap it up for today.
Sounds good. Thank you.